What if I told you that the group dying earlier, taking the most dangerous jobs, and having the highest suicide rates is also the group that rarely asks for help? And what if I told you that this group is men? Across the world, men are more likely to die from accidents, addiction, and untreated mental health problems. Yet, when we talk about gender and welfare policies, we almost never talk about men's health vulnerabilities. So today, let's explore an uncomfortable but important question. Are we overlooking a silent public health crisis among men? Let me tell you a story, not a statistic, but a real situation that many families experience. Rajesh was a 38-year-old construction worker in a growing Indian city. Every day, he climbed scaffolding several stories high, carrying heavy equipment under the hot sun. Like many workers around him, he had no regular health checkups. He smoked occasionally to deal with stress, and when he felt chest discomfort, he ignored it, because in his mind, he had one responsibility: provide for his family. His wife sometimes asked him to visit a doctor, but Rajesh always replied the same way: "I'm fine, don't worry." One afternoon at the construction site, Rajesh collapsed. By the time his colleagues rushed him to the hospital, he had suffered a massive heart attack. Doctors later said something important. His condition might have been detected early if he had undergone a simple health screening. But Rajesh never believed that he needed help. Stories like Rajesh's are not rare. In fact, they reflect a deeper pattern in public health. Many men grow up believing that seeking help is weakness, so they ignore symptoms, suppress stress, and keep working until their bodies fail. And that is why understanding men's health is not about competing with women's welfare. It is about recognizing that every gender faces different vulnerabilities, and public health must address them all. So, the title of today's health policy discussion is The Invisible Gap: Why Men's Health Needs Gender-Inclusive Policies. Hello and welcome. Today, we are going to talk about something that is rarely discussed in public health conversations: men's structural vulnerabilities in health and society. Across the world, and especially in countries like India, discussions about gender and welfare often focus on women's empowerment and protection, and rightly so. For decades, women faced structural disadvantages, limited education, poor access to healthcare, financial dependency, and serious risks related to pregnancy and childbirth. Policies were created to correct those inequalities. But today, we need to ask an important question. Are we paying enough attention to the health and social vulnerabilities faced by men? Because when we look closely at epidemiological data, something surprising appears. Men often experience higher mortality, higher suicide rates, greater occupational risk, and lower life expectancy. Yet many of these problems remain invisible in policy discussions. So today we will explore three important questions. What are the structural health challenges faced by men today? Why are these issues rarely addressed in social protection policies? And how can digital innovation help create gender-inclusive health systems? Let's begin. Part 1. The silent health burden among men. Let's start with the data. Globally, men tend to die earlier than women. In many countries, the life expectancy gap between men and women ranges from 5 to 7 years. In India too, men have higher premature mortality rates from several causes. But why? The reasons are complex. First, occupational risk. Men dominate the most dangerous jobs in society: mining, construction, transport, industrial labor. These occupations expose workers to hazards like heavy machinery, toxic chemicals, physical injury, long working hours, environmental stress. As a result, workplace accidents and occupational diseases disproportionately affect men. Second, risk-taking behaviors. Men are more likely to engage in behaviors such as tobacco use, alcohol consumption, substance abuse, reckless driving. These behaviors significantly increase the risk of heart disease, cancer, liver disease, road traffic injuries. Third, mental health stigma. This is perhaps one of the most serious issues. Men are often socialized to believe that they must always appear strong, independent, and emotionally controlled. Because of this expectation, many men avoid seeking help when they experience depression, anxiety, financial stress, relationship problems. The result is alarming. Men have significantly higher suicide rates in many countries, but mental health support systems often fail to reach them. Finally, there is poor health-seeking behavior. Studies consistently show that men are less likely to visit doctors regularly, participate in preventive screening, seek early treatment for symptoms. Many men only seek care when illness becomes severe. All these factors combine to produce a hidden health burden among men. Yet, these vulnerabilities are rarely framed as structural gender issues. And that brings us to the next question. Part 2. Why men's issues are rarely discussed in policy. To understand this, we need to look at history. For much of the 20th century, women faced clear structural disadvantages. They had lower literacy rates, limited employment opportunities, restricted access to healthcare, high maternal mortality. In response, governments introduced targeted programs such as maternal health schemes, girl-child education initiatives, financial empowerment programs for women. These policies were designed using the principle of equity. Equity means giving additional support to disadvantaged groups in order to achieve fairness. And these programs have had significant positive impacts. For example, maternal mortality has declined. Female education has improved. More women participate in the workforce. However, as societies evolve, new challenges emerge. While women still face many structural barriers, men also face specific vulnerabilities that are rarely acknowledged in policy frameworks. One reason is that many male health problems are interpreted as individual behavioral choices rather than systemic issues. For example, if a man drinks heavily, it is often seen as a personal problem. But public health asks deeper questions. What social pressures encourage this behavior? What support systems exist to prevent it? What policies address it? Another reason is the lack of organized advocacy for men's health. Women's movements have played an important role in highlighting gender inequality. But similar advocacy for men's health issues is relatively limited. As a result, many male vulnerabilities remain invisible in public policy debates. This does not mean women's programs are unnecessary. Far from it. The real solution lies in moving toward gender-inclusive health systems. Systems that recognize the needs of both men and women. And this is where innovation can play a powerful role. Part 3. A new approach. Gender-inclusive public health. Public health is increasingly moving toward a concept called gender-inclusive policy. Unlike gender-sensitive policies that focus primarily on one group, gender-inclusive approaches aim to address the needs of all genders simultaneously. This means recognizing that women may face structural inequalities in areas such as education, income, and reproductive health, but men may face vulnerabilities related to occupational hazards, mental health stigma, risk behaviors, social expectations of masculinity. Both realities can exist at the same time. A truly equitable health system must address both sets of challenges. One promising way to do this is through digital public health platforms. Digital tools can overcome many barriers that prevent men from seeking help. For example, men who hesitate to visit mental health clinics might feel comfortable using anonymous online counseling platforms. Workers in high-risk occupations can receive real-time safety alerts and training modules through mobile apps. Preventive health reminders can encourage men to monitor their blood pressure, blood sugar, and lifestyle habits. Digital platforms also allow governments and health systems to collect real-time data on health risks, enabling more responsive policy interventions. This leads us to an important idea. What if we created a dedicated digital platform designed specifically to address men's health vulnerabilities while complementing existing health systems? Let's imagine what that could look like. Part 4. The idea, a men's health digital platform. Imagine a mobile application designed to support men's well-being, not just as a medical tool, but as a comprehensive support system. Such a platform could provide anonymous mental health support, allowing users to talk to counselors without fear of stigma. Preventive health tracking tools that monitor blood pressure, diabetes risk, and heart health. Workplace safety modules for laborers and industrial workers, helping reduce accidents and injuries. Substance abuse support programs that help users gradually reduce tobacco and alcohol consumption. Information about welfare programs, insurance schemes, and labor protections available to them. Perhaps most importantly, the platform could create peer support communities where men feel safe discussing challenges they rarely talk about in public. The goal would not be to replace existing health systems. Instead, it would complement them, making healthcare more accessible and approachable. This kind of platform could become part of a broader vision of digital public health transformation. Conclusion. Let's conclude with one key idea. Public health is not about choosing one group over another. It is about recognizing vulnerability wherever it exists. Women's empowerment programs have played a vital role in correcting historical inequalities. But as societies evolve, we must also acknowledge emerging challenges faced by men. Higher occupational risk, higher suicide rates, poor health-seeking behavior, and social expectations that discourage emotional support. Addressing these issues does not weaken gender equality. In fact, it strengthens it, because true equity means building systems that support everyone's well-being. The future of public health lies in inclusive, data-driven, and compassionate policies. Policies that recognize that health is not just a biological issue, but a social one. And when we design systems that help people seek support without stigma, we build healthier communities for everyone. Thank you for listening.